Hey Ben, how's it going?
Good. How are you?
Good. Thanks for joining us today for another documented series. We're really glad to have you talking with us today. And
Absolutely.
for before we get started, would love to know how was your weekend? How's the week been? Anything new on the docket?
Well, I'm glad to see the sun is coming out more confidently, so we can
Oh
spend
yeah.
more time
How
outside.
was the weather by you actually? Because we enter May and it is just a windstorm here in Denver in May.
Yeah, we get that sometimes. So I live in Nashville, North Carolina, up in the mountains. So we can. I remember I actually went to undergrad up here too, and it snowed around graduation. So
Oh, yeah,
it can happen. But no, we're starting to see the sun and the flowers are blooming, and I mean
that's nice.
it's nice.
That's great. Do you get seasonal allergies like I do? Because I feel like
I do. We have pine trees nearby, and it's just like clouds of yellow dust
I do.
everywhere.
It's everywhere here. I feel like that's why, so forgive me. I sound like I'm stuffed up because of that, because it's May.
Yeah.
Well, let's get into learning about you and learning about Pluritem because it's a really, really awesome company. But we'll start with just kind of having you tell us about yourself and how you got your start and go from there.
Sure. I'm just realizing, seeing myself on camera here, that I'm kind of establishing my nerd credentials because I've got my Millennium Falcon shirt on with my like
I love
Yoda in
it.
the background here.
Yes, I
Um,
love
uh, so clearly I'm a nerd and I'm okay with it.
Yeah.
Um, but yeah, my background is I've been in the software industry for about 20 plus years. I started out in physics. I was actually thought I was going to do a physics PhD, but then I realized I didn't like being in the underground lab all day.
Mm.
And uh, and then this was right about the dot-com era, so I went and got a computer science degree and launched out just as the dot-com era was exploding
Yes.
and going on tube.
Yeah.
So it was a fun ride though. But I got pretty early into the startup scene and did a couple other things, but I pretty much been in that startup scene for most of that time, and I like it. I like it. I got to see the software industry change over time. Back when I started, you were carrying around $20,000 servers and $100,000 servers, and everything was in. We got excited that we didn't have to do servers anymore to getting involved with Amazon later and really getting to be part of the software as a service revolution. And that's what I've been doing the last 10 or 15 years. And I think it's really exciting. So being able to do that in healthcare, which is what we do, that was a fun transition. But I think I've always loved being in the software industry. It's the flexibility and the interesting things you can do, and to see how you can build a company from nothing to something in a year. There's really nothing else like it.
Yeah, and never a dull moment. You're constantly learning and growing and changing, and
Yeah,
that's the cool thing about it too. Yeah.
right. Wearing at least six hats, minimum five
Oh.
job titles.
I know how that is. So and kind of what's kind of steered you toward health and wanting to start Pluritum?
No, it's a great question. So, I mean, part of it is that I've been in the kind of data side of things. I worked for a couple of data companies, and I'd had healthcare customers before, so it was always on, kind of sidelines, and I'd always been thinking about it. And my co-founder, John Clark, he came from that background. He actually worked for a company called Glimpse that was one of the first personal health worker companies. And so they would go out and grab people's records, and Apple liked them so much they ended up buying them, and he was working at that, and we were good friends otherwise, and we'd always talk about things to do. And he'd over time been convincing me that there was some interesting things going on in healthcare. So when the startup I was with went IPO, and I had time on my hands to start thinking about other things, I my brother is also a healthcare provider, and he just invited me to come uh, to his clinic, and I just sat in there for a couple months interviewing people and trying to figure out what the problems were, and really if there's one thing I've learned about healthcare, there are many problems to solve.
Sure. Well,
So it yes, like a overwhelming number of problems. But the thing is, I really grew to love it, and so then formed the company a little later, and that was the rest is history, as they say. But it was built off of that foundation that I could see the good that primary care doctors and the staffs there were doing for people. We live in a somewhat rural community, to see that how important they were to the communities, and I was like, you know what? if I can do something to make those people's jobs easier and to help them, have more of an impact, that's great. Then it's just a matter of figuring out what's the right way to do that.
Right, right. And so many avenues to do that. But this
Yeah.
avenue that you chose for Pluritum is genius. And I know it resonates with me. It probably will resonate with everybody. So, yeah, can we get kind of more into the nitty gritty of what Pluritum does?
Yeah. Yeah, absolutely. I mean, if there's one thing I saw early on is that, if there's one thing that, doctors and healthcare practices have too much of, it seems like it's data. They're swimming in data, but what they're swimming
Yes.
in is faxes and PDFs and old legacy healthcare documents. And the point is they're sitting on a gold mine of information that could actually help them provide better care, but they're not able to do it because it's in these legacy formats. I mean, I've talked to one cardiologist that I got to know that, he would say he would get 90-page PDFs and there'd be literally 2 or 3 lines in there that he had to find. And I've talked to multiple doctors, about how they would have these giant documents and they would come in and their patient would be like, "Hey, have you looked through my medical history?" And they're like, "You mean that 30-page PDF that I had 3 minutes to read before I came into the room?"
That
So
actually
it
makes sense now that you say that because and maybe this is I'm happy you said that because sometimes I go to the doctor and they'll come in and they won't have kind of the basics and I'm like, didn't you read my chart? Like it takes 2 seconds to read those charts, but now I know it really doesn't. Because I would get kind of sensitive about
and it should. I mean, and the thing is, if you everything else you see and the software you touch, you expect that to be the case for these doctors, and
it.
it's not. And the thing is, and you end up getting asked all the same questions, right? Over and over and
Yeah,
over again.
right.
So, but the bottom line is that, we saw a statistic from GE Healthcare recently that said, 97% of healthcare data is unused.
Mm-hmm.
And that's with the fact that almost all, hospitals, clinics, everybody is using electronic health records, yet it's not doing anybody any good. So we could see that that was a problem to be solved, right? And so what's the problem? The problem is that they're getting all these legacy documents, these PDFs that aren't useful to anybody. So our mission at the Pluritem Health then is to take that data and make it useful, make it actionable. And at the end of the day, what does everybody want to do? Everybody wants to improve health outcomes and they want to reduce cost. But
Yep.
that's easier said than done, right? So fundamentally, there's two things that we were looking at. Is like, how can we help them do that, and where do we think is going to be the most receptive place for that? So the way that we do that is we take that data and we essentially take all those documents, we convert them into, call them like health facts about a person. We dedupe it, we look at, because sometimes people will get diagnosed for the same thing 30 times. Nobody needs to know that you were diagnosed with diabetes 30 times. It's just you have diabetes, right? And kind of organize that into a consolidated picture of who you are as a patient. And then once we have this really nice, clean data set in a very like modern platform, then we can do really interesting things. Now we can start to say, okay, well, what are your biggest health gaps? Okay, well, I've recently come to the age where I had to go get, all these different screenings, and have to go get colonoscopy, God forbid.
Yeah.
And but those are the things that save people's lives, right? Is going into getting those kind of things. So we do that, but also saying, hey, what what things do we suggest you look at? Well, this is a diabetic. They haven't been managing their blood sugar very well. That's something that you can make a big impact by doing that. Or it could be, hey, this person's going to be pre-diabetic in a couple of years if they don't make changes to their lifestyle, right? And
Mm-hmm.
the holy grail that we're all working towards is I would like to be able to look at a 30-year-old and be able to say, hey, if they stay on this path for the next 20 years, they're going to end up like this 67-year-old who's now it's too late to save money on healthcare because they've got all these chronic diseases. So the whole point is to get ahead of that. Now then the other part of that is who's the most receptive to that with primary care. So if
Right.
you can go into a primary care doctor, they have the most likelihood of being able to make those changes and being able
Mm-hmm.
to help patients and guide them the right way. And the other part of this story is that we really fell in love with direct primary care, which is a system where you pay a subscription fee.
Okay.
And like, so for example, I could pay a couple $100 and my whole family gets unlimited primary care, right? And it's a really fascinating thing. And now you're going in and spending 90 minutes with your doctor. I mean,
Great.
imagine
So
that. Not 15 minutes, 90
yeah,
minutes, right?
90 is a long time.
Yeah, so and you're not doing insurance, you're not wearing it's not a transactional relationship, which is the way most of this is. So they're very, very receptive to this. So where we found a lot of success so far is we can go in with that kind of audience and they may be operating at a really small scale or they might be one of these companies that are, serving a company like Amazon or Apple where they're actually operating a huge scale, but it's the same problem they're solving. It's like how can I provide personalized scale at a lower cost? And so we can come in with our analytics and our data and help them do that.
That's amazing. I think that's so great. So early on, kind of what was how did they adopt this? Were they easily like, yes, we want this, or were they kind of, how will this work for me?
Well,
And
Well, there's always a story beneath the story. Like I think at the end of the day, you want to go in and solve the problems that they have right at hand, and then you earn the right to solve other problems. So what you see with a lot of these doctors' offices, and particularly the larger they get, is that one of the biggest problems they have is they're not even getting the records they need on their patients.
Mhm.
So, for example, I mean, one thing I always remember is I went and got a couple of tests, and I literally had to go get the data myself, take screenshots of it, and send it to my doctor. I mean, it's
Yeah,
ridiculous in
yes,
2024, right?
yes, for
I'm taking screenshots of my blood pressure readings from my phone, right? So being able to solve those immediate problems is getting them the information on their patients that they need and on new patients and things like that. That's an immediate problem we can solve. And then you earn the right to do, okay, well, let's do something more proactive here. How can we help you if you bring on 100 new patients, who do you go and work with first? Well, let's figure that out for you. And then how can you also demonstrate to your patients, to employers that you're making an impact? Well, let's quantify this and let's put it on a dashboard. So, but you usually have to solve those really core problems first. Let's just get you the things you're looking for. Let's get those lab results from last week. Let's get those that history of diabetes for the last 2 years, and that's usually where we're starting.
So when they have all these documents, like pages and pages of stuff, and you guys come in, can they what's the transfer there? Or do it's just like, here's this program, now you fill out this and it will kind of replace that clunky stuff that
Well,
you have.
the simple version of it is that one of the things that government has managed to do in the last 10 years is that they forced some of the big players in the industry to open themselves up for requests. So
Okay.
if we work with a doctor and they're treating you as a patient,
Mm-hmm.
and we basically have all the things in place, then if they request your records, pretty much everyone on these national medical record networks, they actually have to respond by law, and
Okay.
they're obligated to respond. So if we're working with a doctor, then we can go request your records and we can get most of your records like within minutes, right? The reason why that's not usually what you see in offices, there's lots of different reasons for that, but a lot of it is because antiquated software and also the stuff that they're getting is nearly useless. So what we do is we'll take those medical documents that are not available and we make them useful. We make them actionable and we combine them. So instead of having again, you'd be surprised how many times in these documents they'll describe the same condition over and over again. Like
Sure.
we don't need to know that you don't smoke 30 times.
Right.
We just need to know that you don't smoke. Um, well, and the funny thing too is we have to do some intelligent things. My co-founder and I were talking about this. Is sometimes what you'll find is that it will say two different places that here that they don't smoke and over here that they do, or over here they don't drink and over here they do, because they're not actually the patient's not always being honest either.
Right.
So
100%. You get
yeah, so
nervous.
you and never done that, right? But
Yeah.
yeah, so there's some complexity to it, but the bottom line is instead of them having to look through a 90-page PDF, impenetrable document, we're giving them a simple UI they can put on a tablet, put on their phone, and they can sit there with the patient and like actually have a conversation. Imagine that.
Yes. Yes. And that makes all the difference. And then you feel like the doctor actually cares and wants to provide the best treatment. So it works, it's
Right,
both ends for sure.
right, right, exactly. And then once you have that data in that kind of accessible format, that scales up. So now if you're a hospital trying to answer questions, or you're a health plan, or
Right.
you're multi-office doctor's office, you can start to ask these really important questions at scale.
Hmm. Yeah, no, I love that. And from a patient point of view, it seems like it's a very easy system to adopt and, seamless.
Right, right, exactly. And the patients are part of that too. We can give patients access to their records once they've gotten worked that out with their doctor. So it's
Yeah,
a
how
but the
does that
but the
like does that work for them, from the patient standpoint?
well, there these things can get complicated, but the reality is if you as a patient ask for your records, you will very rarely get a good answer. It shouldn't
Right.
be like that, but that's just the way it is. You'll typically get either something you can't use, or
Hmm.
you won't even get a response because they're actually not always obligated to respond the way you would like. So if you go through your doctor and we work with your doctor gets all those results, and then as long as your doctor signs off to give you those records, and you work, then you can. It's your records, so we can give access to those. But unfortunately, if you go ask for them yourselves, a lot of these solutions that are out there, you don't usually get very good answer. You usually get summaries that are not very useful, or you get patchy data just because of the state of the system. So because we go through your doctor, we're going to get a much better view than what you would
Hmm.
get on.
That's great. I love that. I feel like I could pick your brain and talk to you about it all day, all day, but I will move
Well,
on
like
to
it's one of those things that everybody understands because everybody's gone to a
it
doctor's
is
office and then struggle with that. And I think everybody's in the healthcare system. If you want to hear, the common complaint is always going to be about medical records, electronic health record systems. Like everybody is
true.
suffering that same thing, right?
Well, and there are even places I think I'm still filling out paper forms. Even like my daughter's pediatrician will go there, and I think I've filled out the same form for the last 6 months that we've gone to the
Oh
doctor.
yeah, you go to dentist now, you'll fill out that paperwork too, and
Yeah, I'm like, don't we already have this on file? But that, to your point, that's how it works. So
yeah,
the you guys
exactly.
are doing great things. That's awesome that we're streamlining and getting things at least to be especially more useful because that's the biggest thing.
Yeah,
Because you know that
and
you're
and there's
doing it.
something I've learned over the last particularly the last 10 or 15 years is that if you put data in an accessible way and you make it easy to access and easy to understand, you will basically unshackle the experts. And so I at the end of the day, I don't know all the ways this data is going to be useful to the healthcare professionals that need it. But what my job is to do is make it easy for them to get to it, easy for them to use it. And then, they're going to be the ones that are going to come up with the innovative, interesting ways to make use of that data. They just don't have it.
Yeah, no, that's a really good point. So, kind of on that point, any kind of cautionary tales that you've encountered with your company, in the first few years, or advice, anything like that that you want to share?
Yeah, no, absolutely. Well, I was reminded as I was thinking about doing this interview, like I love to listen to this one particular podcast, like How I Built This, and he
Yes,
talks
I
with,
love how it.
yeah, great podcast, and he talks to founders, and one thing you always hear is that oh, if I'd known how long this was going to take before I did it, I might not have done it. So sometimes going in there, ignorance is bliss, but
Yep.
everything takes longer than you think it's going to take. But
Hmm.
then a lot of stuff happens much faster than you think. It's really hard to predict, but
Hmm.
uh, sometimes things can be much harder than they look on the surface. But the counterpoint to that is if it's difficult and you do it, that's your earned secret. That's your differentiation. So you don't want to avoid the hard things, but I think it's very hard when you go in if you're solving an important problem. It's really hard to know exactly how long it's going to take. So sometimes you just have to go in on faith and you work in. But I think the key part is, and if there's one thing I've learned about this, it's very easy to zoom in on one particular customer problem and just zoom in and start solving that. And as a valid techie geek, like it's fun to go in there and solve somebody's problem, right? But if
Yeah.
there's one thing I've learned about that, you have to be careful that you get a real idea of what's going on because, like for example, with the problem we're trying to solve, when I first started looking at it, I thought this was a paperwork problem. So like,
Mm.
let's go solve paperwork, but it's not really a paperwork problem. It's a data problem, right? So, we spent a little bit too much time really early on solving a paperwork problem. So we learned that and we pivoted, but that's the key is that you want to get as much input as you can but then be very willing to pivot because the more you learn about a problem, the more you're going to understand better ways to solve it. And the more you listen to customers and get their input, you're going to change how you're going about it. And that's okay. It's just that the key is being very flexible as you get into it. And, how many companies have you heard that start off was like, I think Slack was like a game communication company before they start, a lot of these companies, they start off doing something completely different. So the key is that you're flexible
Right. Your
and that
mermaid
you're
is where you're going to kind of navigate from there.
yeah. And you have to be humble because I mean, it's sometimes hard realizing that you don't know all the answers and that you will be flummoxed and things will take longer. But if you go in with a humble attitude and you listen and
Yeah.
you spend time with customers, I think you will usually come to the right answer.
Yeah. Well, that's great. I feel like that's advice for, other people starting up too. So that's great. Great advice.
Yeah.
Well, thank you so much. Is there anything else that I didn't ask or you want to share about Pluritem? Great company. Everybody should check it out. Oh yeah, and actually tell us where we can find you, best way to kind of get in touch with you.
Yeah. So yeah, our name Pluritum came from two Latin. It's like a bastardization of Latin, where it's like
Okay.
pluribus tempus, so more time because we're giving more time back to doctors, more time to patients. So
Love
so
that.
it's so pluritemhealth.com where you can go find us and see what we do. And yeah, and look, I think what we're trying to solve a really important problem, but the people that we partner with is what makes it possible. So, I'm excited to, talk to more customers and talk to more partners and work with companies like you guys where, help us take care of the things that make, start not fun,
Yeah, for
with
sure.
documentation and and basically helping us take care of all that stuff that can sink you. And then that way we can focus on the real problem we have to solve.
Exactly. Well, that's great. Well, come talk to us again as you kind of get further and further along because I definitely want updates on how it's going. And thank you so much for talking to us today.
Thank you too.
All
Appreciate
right.
it.
Talk soon.
Okay.